Hi YouTube, Christine here, Skinny Brit to be, coming to you with my week 90 post RNY gastric bypass, and I suppose my week 2 maintenance. Maintenance is going well. I'm within 0.4 of my goal, except my target, which was 145. I've fluctuated sort of daily up and down, you know, sort of half, quarter of a pound, etc. But so far, that's where it's sticking. And it's also tending to go a little bit below. So we'll see where it settles. But I'm quite happy at the moment. Especially as I have news on my gallbladder. I went to see the surgeon last week, and oh boy, that was a different experience. My previous experience with most surgeons is that they were a little bit shorter time. They were willing to answer questions, but there was not a lot of warmth came over, let's put it that way. It was just pure business and let's get this patient out of here and on to the next one. Well, this one was completely different. My husband and I arrived at the waiting room, etc. and we thought, right, okay, here we go. And the nurse came to collect me, and I thought, oh, well, she's going to do all the standard things, you know, weigh your blood pressure, height, etc., etc. Well, she didn't. She said, I'll take you to the quiet waiting room, which sort of made me think, well, that's a bit strange. She said, is your husband with you? And I said, yes. She said, well, we'll go back and collect him. So we went back and collected him, and she took us to a small sort of side room that presumably at some stage was a consulting room, but there was a sofa in there, and she sat us down and she said, you know, we'll be back in a moment. Well, strangely enough, alarm bells started to ring, because that little room was also a room where I received some not so pleasant news some time ago, and not to do with myself, I might add. And I thought, oh God, you know, is this going to be bad news or something? Anyway, the surgeon breezed in, sat down, all friendly, said I've had a fantastic letter from your GP, said how amazingly well I'd done with my RNY, and did I realise that not many people actually had my amount of success. So I thought, well, okay, we're on a roll here. And he said, I like all my patients to be fully informed as to, you know, what the potential, you know, sort of risks of surgery are, etc. He said, so I've got a video here. He said, I'd like you and your husband to watch. And he said, it's about 20 minutes. He said, when it's finished, he said, I will come back. He said, if I'm not back straight away, he said, don't worry, I will be back. And he said, would you like a cup of coffee in the meantime? And the nurse was still sort of hovering there, and I said, I suppose that's your job, is it? I said, black please, no sugar. And she asked my husband what he wanted, etc. I said, I can't really expect the surgeon to make it. And he said, well, I have on occasion. Anyway, he breezed off after setting this video going and explained in absolute details all the pitfalls, all the good points, all the bad points of having your gallbladder removed, etc. And it was actually him doing the video, and he took us on a tour of the hospital on this video, showed us the day unit where it was done, etc., how you would walk to theatre, etc. Oh God, I wish somebody had done a similar sort of video for my bypass, because I think it's quite alarming when things aren't very familiar, etc. Anyway, he went through the whole procedure, explained everything, and there was about a minute to go, and he came breezing back in the room and, you know, sort of said, you know, okay, was that all right? And he chatted away about how, you know, my husband asked him, you know, if they'd done the recording of it all in one go, and he said, well, over one day, and he wanted to chat about how the film had been made. And he said, I'd just like my patients to be informed. He said, what would you like to do? And I said, well, I think the sooner you get rid of it, the better. You know, I said, I don't really want any more doses of pain, etc., like I have been having. And he said, oh, well, okay then. He said, I'll give you a form in a second. He said, you can go down and book your admission date. And there's me sort of, this is not the British NHS, this is not how it normally works. So anyway, he told me where to go, and the nurse sort of escorted us half of the way there, got us into the lift, etc., and down we went to the back of beyond sort of thing in the hospital, etc., and we breezed in, and the area for the booking clerk, there were quite a few people in there anyway. They'd obviously all been seen to, so she took my notes. And I thought, God, we're going to wait on the end of this long queue. But she called me back about 2 or 3 minutes later, and she said, how does the 24th of October suit you? And I said, yeah, that'll be fine. She said, can you come for pre-op next week? Now, the Brits will understand my absolute amazement at this, but yeah, that's just not how the NHS works. The NHS sort of sends you away, and eventually, 6 months down the line, no, not quite as bad as that, will send you a letter saying we've booked your admission. And anyway, I sort of came out of the hospital thinking, my God, because I really thought I was perhaps going to have to sort of argue my case for getting this rather annoying gallbladder removed. Anyway, yesterday I had reason to see my GP, and he said, have you had any luck with the hospital yet? I said, yes. I said, I've got my admission date. I said, it's in fortnight tomorrow. And he said, wow, that's quick. He said, all done within a month of referral. He said, I don't believe it. He said, if you get sent as a priority, if I'd have been sort of virtually an emergency, he said they have to do it within a fortnight. He said, but I never dreamt, he said, that they would do it under normal circumstances within a month. Anyway, so 24th of October, they're going to take my gallbladder out. Does stage surgery, unless some sort of complications occur. Anyway, so that's that. Hopefully will be sorted. I'll just have to grin and bear it until then. But hey, it's not every day it strikes me, but it's a right pain in the neck or in the stomach, whichever way you look at it. Okay, the second thing that I've had this week, which has been again very surprising. Some weeks ago, I had a sort of senior moment, and I decided that I'd get down on the floor and see whether or not I could do sit-ups, which I did do. But as a repercussion of that, the following day my coccyx was really sore. I'd been noticing that it was sort of sore, and I thought, oh, doing the press-up, not the press-ups, the sit-ups on the floor, maybe that had, sort of bruised my coccyx, because I haven't got much padding down there. Well, I haven't got any padding down there. Anyway, that was sometime in August, and it's progressively sort of got sorer and sorer until I realised that I'd actually got quite a sore spot on between the cheeks, so to speak. And I thought, oh, it must be the good old-fashioned chafing and rubbing and the normal fungal infections, etc. that we get. Anyway, so last night I presented my RIA to my lovely GP last night, and he tells me that he thinks it's pressure sores. So I must be a strange patient. I've got almost the equivalent of bed sores from sitting in a chair. So he suggested that he's given me some cream to put on it, etc., and hopefully it'll clear it up. It's antifungal, anti-something, antihistamine, anti-cortisone and antibiotic, all in one. He said we'll cure it 3 ways, see whether or not we can get it cleared up. But he said in the meantime, he said, I don't know where you're going to get one, he said, but I suggest you perhaps try and get a rubber ring to sit on. So if your bottom is sore, your coccyx, etc., do query whether or not you've actually got a pressure sore there, because it just didn't even enter my head that it was a pressure sore. So that's my exciting week. Before I go into hospital, I have bed sores to contend with. Oh, you've got to laugh, haven't you? This journey is so weird. Anyway, that's it. That's my thrilling week. And of course, most of you will have heard that I met Sally, Cabernet Queen, over the weekend, and we had an absolute blast. It was just so much fun to meet her and her husband. And oh dear, we did eat a little and drink a little, but it was lovely. But we're back on track now. Well, I think she's back on track. Are you back on track, Sally? I hope you're all doing well. Keep up the good work. You'll all get there eventually. Sometimes you go through all this journey. I hear girls talking, you know, desperate to actually have their RNY, and that is such a you think that it's never going to come, you're never going to get the decisions, etc., but it does come. It just seems to take forever, and of course you're so impatient. And then of course you have the surgery and you want it all to fall, you want all 10, 15, 20 stone of it to fall off within the first 10 weeks. And it doesn't happen, so you get frustrated, and you've just got to stick with it. Honestly, you've got to stick with it. I've never been a fast loser. I've always lost only between £1 and £2 a week. So just bear with it, ladies. And gentlemen, if you're watching, you'll get there. But you've got to change the way you eat. You really have. It's got to be a decision for the rest of your life. Preaching. But it's so true. Anyway, done preaching, done rambling. Bye for now. Love you all. Bye.